Sleep disorders in adults, causes, symptoms, and treatment. Sleep disorders are a common problem among adults, affecting millions of people worldwide. Understanding the different types of sleep disorders and their causes is the first step in managing and treating them. Understanding sleep disorders. Types of sleep disorders. Insomnia. One of the most common types of sleep disorders is insomnia. Insomnia is characterized by difficulty falling asleep or staying asleep, or waking up too early in the morning. Some causes of insomnia. Caffeine. Caffeine has a short life, meaning 80% of caffeine leaves the body within 8 to 10 hours. So if you're consuming caffeine in the afternoon and evening, it can interfere with your falling asleep. Medications. As we age, many times, there is an increase in the number of medications we take. If you take medications and suffer from insomnia or sleep disturbances, talk to your doctor. Many times there are alternative medications you can take that may not interfere with sleep. Don't stop taking any medication that your doctor has prescribed or suggested until you talk to him/her, as that can be dangerous. Nocturia, a common medical condition, is characterized by the need to wake up during the night to urinate. It is more prevalent among older individuals, but it can affect people of all ages. Nocturia can disrupt a person's sleep patterns, leading to fatigue, reduced quality of life, and potential health issues. The condition can be caused by various factors, including an overactive bladder, an enlarged prostate in men, urinary tract infections, and even certain medications. Depression and stress. Depression is a common cause of insomnia. Though an increase in sleep is seen in some people with depression, studies show that 80% of people experiencing depression have trouble falling or staying asleep. Stress is a major factor that can disrupt your sleep. When you are under stress, your body releases hormones that can keep you awake and make it difficult to fall asleep. This can lead to chronic sleep problems if not addressed. Lack of exercise. As we get older, we tend not to get out and move as we once did. If you think back on the days of childhood, we were always on the go. We loved to play outside, and we had recess at school. It seemed like we needed no excuse to get up and move. As adults, when we go to work, we might have a desk job that requires minimal walking. If we are retired or stay at home most of the day, we get minimal exercise. Sleep apnea. Sleep apnea is a disorder in which you stop breathing for short periods during sleep. There are two types of sleep apnea: obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea is caused by the collapse of the airway, while central sleep apnea is caused by a failure of the brain to signal the muscles to breathe. Sleep apnea is not insomnia but could cause the middle of the night awakenings. Some signs of obstructive sleep apnea are chronic snoring, difficulty breathing/gasping for breath, and choking. If you do have sleep apnea or suspect you might, this should be taken seriously, and a doctor should check you out, as it can be deadly. Restless leg syndrome. Restless leg syndrome is another common sleep disorder. It is characterized by an irresistible urge to move the legs, especially at night. This can lead to difficulty falling asleep and staying asleep. There are many types of RLS, but the most common form affects about 1 in 25 people. Symptoms typically start after age 50 but can also occur at any age. Narcolepsy. Narcolepsy is a sleep disorder that causes excessive daytime sleepiness. It can also cause sudden muscle weakness or paralysis, and hallucinations. Circadian rhythm sleep-wake disorder. Circadian rhythm sleep-wake disorders are a group of disorders in which the sleep-wake cycle is disrupted, such as found in shift workers and persons experiencing jet lag. Shift work disorder is a disorder in which you have difficulty sleeping because of your work schedule. Jet lag is a temporary circadian rhythm sleep-wake disorder that occurs when you travel across time zones. Parasomnias. Parasomnias are a group of disorders in which abnormal movements or behaviors occur during sleep. Sleepwalking, night terrors, nightmares, and REM sleep behavior disorder are all examples of parasomnias. Causes of sleep disorders. There are many factors that can contribute to sleep disorders in adults. Some of the most common causes include stress, aging, medical conditions, allergies, chronic pain, arthritis, diabetes, and pregnancy. Stress is a major factor that can disrupt your sleep. When you are under stress, your body releases hormones that can keep you awake and make it difficult to fall asleep. This can lead to chronic sleep problems if not addressed. As you age, your sleep patterns may change. You may find that you wake up more frequently during the night or have trouble falling asleep. This is because the body produces less of the hormone melatonin as you get older. Allergies and chronic pain can also disrupt your sleep. Allergies can cause nasal congestion and other symptoms that make it difficult to breathe at night. Chronic pain can make it difficult to get comfortable and fall asleep. Arthritis can also cause sleep problems. The pain and stiffness associated with arthritis can make it difficult to get comfortable and stay asleep. Finally, pregnancy can cause sleep problems due to hormonal changes and physical discomfort. Many pregnant women experience insomnia, restless leg syndrome, and other sleep disorders during pregnancy. Sleep disorders and other health conditions. Sleep disorders can be related to other health conditions. In the United States, sleep disorders are a significant public health concern. According to the Centers for Disease Control and Prevention, CDC, insufficient sleep is associated with a range of health problems, including obesity, diabetes, cardiovascular disease, and mortality. Effects of sleep disorders. Sleep disorders can have a significant impact on your overall health and well-being. Poor sleep quality can lead to a wide range of negative effects, including mood disorders, relationship problems, irritability, lack of energy, poor performance, and safety issues. One of the most common effects of sleep disorders is a decrease in overall quality of life. When you don't get enough sleep, you may feel tired and lethargic throughout the day, making it difficult to enjoy your daily activities. This can lead to feelings of frustration, anxiety, and depression. Sleep disorders can also have a significant impact on your mood. People who suffer from sleep disorders are more likely to experience mood swings, irritability, and anxiety. They may also have difficulty concentrating and may feel less motivated to engage in social activities. Relationship problems are another common effect of sleep disorders. When you're tired and irritable, it can be difficult to maintain healthy relationships with your partner, friends, and family members. This can lead to feelings of isolation and loneliness, which can further exacerbate your sleep problems. Lack of energy is another common effect of sleep disorders. When you don't get enough sleep, you may feel sluggish and lethargic throughout the day. This can make it difficult to perform at your best, both at work and in your personal life. Poor performance is another effect of sleep disorders. When you're tired, you may find it difficult to concentrate and may struggle to perform even simple tasks. This can lead to decreased productivity at work and poor academic performance. Safety issues are also a concern for people with sleep disorders. When you're tired, you're more likely to have accidents or make mistakes that could put yourself or others in danger. This is especially true if you operate heavy machinery or drive a vehicle. Symptoms and diagnosis. The most common symptom of a sleep disorder is excessive daytime sleepiness, EDS, which is a feeling of tiredness or sleepiness during the day. If you're feeling tired or sleepy during the day, it could be a sign of a sleep problem. Other symptoms of sleep disorders include difficulty falling asleep or staying asleep, waking up too early, snoring, gasping for air during sleep, and feeling restless during sleep. If you're experiencing any of these symptoms, it's essential to see a doctor for a diagnosis. Your doctor may conduct a physical exam and ask you about your medical history and sleep habits. They may also recommend a sleep study, which is a test that measures your brain waves, breathing, and other body functions during sleep. Two common types of sleep studies are polysomnography and the multiple sleep latency test. Polysomnography is a test that records your brain waves, heart rate, breathing, and eye movements while you sleep. This test can help diagnose sleep disorders such as sleep apnea, narcolepsy, and restless leg syndrome. The multiple sleep latency test measures how quickly you fall asleep during the day. This test is used to diagnose narcolepsy, a sleep disorder that causes excessive daytime sleepiness. Solutions. If you are diagnosed with a sleep disorder, there are various treatments and management options available to you. The choice of treatment will depend on the type and severity of the disorder. Here are some common treatments and management strategies that may be recommended. Sleep disorders specialist. A sleep disorders specialist can provide advice on the management of chronic insomnia as well as sleep-related behavioral problems. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is a type of psychotherapy that enables you to understand the thoughts and behaviors that lead to sleeplessness. These thoughts and behaviors are then changed, leading to improved sleep quality. Medications. Medications are often used to treat sleep disorders, including insomnia, sleep apnea, and restless leg syndrome. Some of the commonly prescribed medications include benzodiazepines, non-benzodiazepine hypnotics, and melatonin supplements. However, it is important to note that medications should be used under the guidance of a healthcare professional, as they can have side effects and risks. Lifestyle modifications. Making lifestyle modifications can help improve your sleep quality and reduce the likelihood of sleep disorders. Here are some changes you can make to your daily routine. Establish a regular sleep schedule. Go to bed and wake up at the same time every day, even on weekends. This helps regulate your body's internal clock and improve sleep quality. Create a relaxing bedtime routine. Take a warm bath, read a book, or listen to calming music before bed to help your mind and body relax and prepare for sleep. Limit caffeine and alcohol intake. Caffeine is a stimulant that can interfere with sleep, so avoid consuming it in the afternoon and evening. Exercise regularly. Regular physical activity can help improve sleep quality, but avoid exercising too close to bedtime as it may interfere with sleep. Avoid napping. If you have trouble sleeping at night, avoid napping during the day as it may make it harder to fall asleep at night. Create a comfortable sleep environment. Keep your bedroom cool, dark, and quiet to promote a restful sleep environment. Sleeping in a quiet room that isn't too hot or too cold may help improve sleep. Miscellaneous tips. Eye masks can provide a better sleep environment by keeping light out. If you have a nightlight or even a clock by your bedside that gives off light, this can interfere with sleep. Eye masks are relatively inexpensive, convenient for travel, and have no side effects. Food. Some foods found to help with the difficulty of falling asleep are walnuts, contain melatonin, a sleep hormone, fatty fish, turkey, think Thanksgiving, white rice, milk, contains tryptophan, the same amino acid found in turkey, cherry juice, boosts levels of melatonin, bananas, pretzels. Journaling. Keeping a journal will allow you to put to rest those pesky thoughts instead of having them go through your head over and over again as you're trying to nod off. Jot down those racing thoughts, maybe what happened during the day that upset you that keeps running through your mind as you're trying to go to sleep, perhaps a list of things to do tomorrow. Some people like keeping a gratitude journal, listing 5 things they have to be grateful for. Lights. Light interferes with the production of melatonin, the sleep hormone. Turn off those lights, including bright bedside lamps, TVs, computers, iPhones, and tablets. Progressive relaxation. To use this method, you start at your feet and contract and squeeze one foot and count to 10, then relax. Then you contract and squeeze the other foot while counting to 10 and then relax. Don't forget to breathe. You make your way all through your body one part at a time: calves, thighs, abs, buttocks, arms, neck, back, jaw, forehead, and so on. Some people prefer working from their forehead down to their feet instead. Either way is acceptable. Bath. A warm bath will relax you and help lower your body temperature to make it more conducive to sleep. How this occurs is when you come out of the bath, the air feels cool and thus reduces your body temperature, signaling your body it's time to sleep. White sound. Some machines produce what is called white noise. White noise helps you sleep in 2 ways. It blocks distracting noises. It produces relaxing sounds that help induce sleep. One study found that a white noise machine helps some sleep as much as medication. Good night all. In conclusion, sleep disorders in adults are a common problem and they can have a significant impact on your quality of life. However, with proper diagnosis and treatment, most sleep disorders can be managed effectively. If you are experiencing any sleep disturbances, it is essential to speak with your healthcare provider to determine the underlying cause and develop a treatment plan that works for you. Thank you for watching. To read the full article, go to livingyourSeniorLife.com. The link can be found in the video description.